So, well, no,
Thank you.
please introduce yourself.
So, Dr. Inyang Takon. I'm a consultant pediatrician. I work at the Eastern North Hertfordshire NHS Trust. So I specialize in epilepsy and seeing children with neurodiversity. But I've always done a lot of epilepsy clinics in children between 0 and 18.
Thank you. So, our first question for you is, how can caregivers distinguish seizures from other behavioral symptoms?
Okay. This is a very common one that tends to come to clinics because almost every week, sometimes I get referred children with behavior difficulties that people think that epilepsy. I think one thing about epilepsy, it's very what we call stereotype. So the pattern, just like Priscilla had described the different types of epilepsy, but what you will recognize with epilepsy is that there's a pattern, and that pattern is consistent. So each time it happens, it's going to happen in the same way with the same kind of pattern. So if it was somebody with, she described temporal lobe epilepsy, where the person can be confused, the pattern is always quite typical. You would see the pattern where the confusion, the behaviors they're doing, the fumbling and all that. Now, people with epilepsy, like she's also described, can have absences where they go vacant for a while. But it's quite stereotyped again because there's an on period and an off period. So with things like absences in children with epilepsy, you really can't get them out of it. But they don't tend to go on and on and on. You know, it's a brief onset and brief offset period. We know that a lot of children with behavior problems, you can almost predict that those behaviors will happen at certain times, maybe when the child is overwhelmed. So maybe if parents study, they might find out that maybe it's when they're taking the child to a busy supermarket or a busy place, then the child becomes very distressed and does those behaviors afterwards. Or the child might be having a meltdown and suddenly, you know, in the course of that meltdown, but that's why history is very important, because taking the history will tell you what was happening before that episode. What did the child do during that episode? Could the child be distracted from it? Because behavior issues, you can distract the child from it. You can do something and stop the child from, you know, to bring them out of that episode. So you have to look at patterns. And sometimes, even with that, it can still be difficult. So we encourage parents to record. So everybody has a mobile phone now. So it's so easy that if you're still confused, you know, just take your videos, record it, because just one thing about looking at those videos usually just helps. So sometimes we've taken the history in clinic and it's still unclear, but looking at the video that the parents have brought is so helpful, because we can then see what was this child doing in that absence. We know that children with typical absence might have some high flicking behavior. You would be able to see how they are during that period, and you'll be able to notice when the event has stopped. If it's a behavior, you will see that it's just nondescript. The child may just be doing all kinds of random things. And so there's so many things that we use in distinguishing. But history, documenting, noticing how often is it happening? Is it happening at particular times, maybe when some parents have refused the child to get something, or the child is expecting something and they're not getting it, and then that's when those behaviors happen, and then the child suddenly starts doing those things. And what pattern are you noticing? Yeah.
Thank you. I guess with that, bearing that in mind, how can caregivers recognize seizures in children with autism?
So children with autism, I think we have to recognize that they are, by virtue of the fact they have got autism, they are at high risk of having seizures. And that's the message for most people, is that autism increases your risk, just like learning disability, of having epilepsy. And so parents should be, or people should be very aware. So people with autism do sometimes what we call repetitive behaviors and stimming behaviors. And that behavior can vary with different people. And sometimes it can be confusing to for people to distinguish, is that behavioral epilepsy or is it stimming? Again, just like children with behavioral, sometimes those children are doing those behaviors at certain times. Maybe there's a lot of overload in them and they're doing it, a lot of those rocking, maybe they're distressed or anxious and they're doing those rocking behaviors more. But parents will be able to know, or carers will know what pattern of stimming they've been having. And if anything looks different, I always say, if anything looks different that you are not sure, because I don't want to sit here and say, oh, this is definitely not epilepsy. If you're not sure, video recording and seek medical advice. But just know that people with autism are also at risk of having epilepsy, and that some of the behaviors that they do, which is repetitive, the stimming, the rocking, which a lot of it is sensory, those things have times where they come on more, they have times when they reduce. Well, it's good to just, if you notice anything different, your child best. If you notice that something different, it's better to seek help.
Thank you. So in terms of epilepsy in pregnancy, is it safe to continue taking epilepsy medication during pregnancy?
Yes, it is. And that's a key advice, that people with epilepsy who are pregnant, they're also at a risk period, that if their epilepsy is not well managed, they stand a risk of having more seizures. So, and that is why, for example, in this country, there is guidelines that pregnant women are looked after by a team of neurologists and obstetricians, because there is a risk if they're not taking it. So they shouldn't stop their medication. That team is going to decide on how often or whether they need to adjust anything, but don't stop your medication if you're pregnant, because stopping your medication could increase the risk of complications. And because, pregnancy on its own carries its own risk. So you don't want to have that on top of your epilepsy. So the advice is continue taking your medication, but make sure you are under a team that's following you up, because at a particular time, usually here, I think about 28 weeks, they scan them more regularly, or they've got to be under a team.
Thank you. Is there anything else you'd like to tell us?
I think I'm very much for education. So my big thing is improved education, improved awareness. It is everybody's business to stop you to reduce, this risk of people dying from epilepsy or the mortality. And the earlier that we pick up children with epilepsy, the better. Adults, the earlier we pick them up, we get them diagnosed, the better that their epilepsy is treated. And so I think we discussed all the different facets of epilepsy, but it all boils down to improved awareness, improved recognition, improved emergency care right at the point where people are. Rural areas, everywhere, people should have that information and access at the tip of their fingers. So that's what I want to say.
Thank you.
Yeah, thank you.